my god, I'm so happy you're joking. I was like, Mike either has no idea what he's talking about, or I've said something horribly confusing in a video.
YouTube pranks are a popular topic, but I'm about to go medical with them. But instead of pranking random individuals, I'm targeting doctors.
This is my buddy. His name is Dr. Dilshad Atwal.
Yo, settle a bet for me real quick. You gotta put that real quick in there. If a patient is having back pain for more than 1 week, it's a vertebral fracture until proven otherwise. I just asked this interventional pain medicine doctor, if someone has back pain for a week, it means that they have a broken back. The truth? Back pain for 1 week is most likely a muscle, disc, or connective tissue problem, not a broken back. I'm curious how nice he's gonna be in response. I don't jump to putting that in my differential, but yes, it can be if it's new onset just 1 week. What? The bubbles, they're coming.
For an entire year during fellowship, I saw roughly like 15 on average patients a day. How many patients a day do you see with back pain?
The most common complaint for family medicine doctors is low back pain.
I'm a pain specialist. I see so many people.
But you're telling me this is the difference between what I'm saying and what you're saying. You're telling me an anecdote.
You just said something based on your own anecdote.
No. I'm telling you that I saw it. No.
You said the same exact
No.
thing as me.
So what makes you more right?
Because of the fact that I've seen a larger sample size of patients.
But you're pre-selecting them and you're not doing x-rays.
I'm the specialist that sees back pain all the time.
Oh, and specialists apparently know more.
Yeah. No, legit. Because think about it this way. I'm not going to argue with I'm not going to talk about appendicitis when you're the one who sees abdominal pain so much more than I do.
Yeah, but if you said a reasonable thing about appendicitis, I would listen to it. You're saying mine's an anecdote, but yours an anecdote too.
Mine's is a more experienced, like 1 year versus...
So you have a better anecdote.
You're still not understanding.
No, you're not understanding. Where are you walking around? It looks like you're walking around in a castle.
It's my house.
Oh.
Yeah. Look at this guy.
Oh, look, it's a dog. By the way, I'm just with you. I've been pranking you this whole time.
Oh, so you didn't... I'm like, bro, like, what are you talking about? You got me so mad.
All right, holla.
I just woke up from a nap too, and I was just like, this guy just got my blood like...
You said you got my blood boiling after a nap. Who naps on Friday afternoon? Okay, I chose this one because Dr. Espina was my senior in residency, so he trained me and he gave me a lot of wisdom. I want to try and trick him with this little piece of information. When you have hard to control diabetes and the blood sugar is really high, you told me give them high-dose prednisone for a week and it will help their sugar. The truth? Steroids, i.e. prednisone, actually have a side effect of raising blood sugars, and they need to be very carefully used in diabetic patients. Doctors would not give steroids to help with sugars.
No. I never said that to you.
I remember.
You misunderstood something. No, dude, I never said that to you.
Are you sure?
I would never say that to you. You misunderstood something I said.
I think you're just thinking of it like anecdotally.
No, dude, I'm serious. I would never say that to you. I would never say that.
Over the last 3 years of being an attending, I've been prescribing prednisone to all my diabetic patients.
No, dude. No. No, I can tell you this for a fact. What you're saying is not something I would ever have said.
So you're saying over the last 3 years, everyone I prescribed prednisone for high blood sugar, I've been wrong?
Yes, you really...
Oh no.
I don't know which one of your girlfriends you were fighting with at the time, but you didn't hear that from me.
Well, you're gonna be on the YouTube channel, Dr. Espina, on Medical Prank Show.
No. All right, go prank more doctors. I love you. I miss you. I hope you're good, bro.
Love you, bye. You gotta love Espina. Mike, it's your girlfriends that are... I've only had like 3 girlfriends in the 10 years you've known me. Not 10 years. 7 years. I think that's okay. This one's gonna be my favorite. I mean, Mama Dr. Jones is the epitome of empathy. It's not clear, but how long does menopause last? Keep it broad. Keep it broad. The truth? Actual menopause lasts forever and is a natural part of human aging.
Also, menopausal symptoms vary from individual to individual.
Seen just now. And she's not answering because you know she's thinking about Mama Dr. Jones, I am apologizing for whatever you feel the need to text right now. I promise I don't think this. I don't think that your menstrual cycle will restart in your 80s. She's typing a long response. She's like, this doctor needs a lesson. Wow, she's really typing. Menopause is just defined as a year without cycles in absence of other causes, so menopause is forever. Symptoms like I told you, vasomotor instability are very unpredictable. Some experience for 2 to 3 years, starting a bit before cycles stop, and others can experience symptoms for way longer. Some people have no symptoms at all, but when does it restart? I wish I see her face. She goes, I don't understand what you mean restart, like cycles? I wrote, well, yeah, after the pause, the hormones can come back, right? I swear that when I was taught that the pause after the year, it could restart, and that's why it was called the pause.
By definition, menopause is, and we're talking about someone who's the normal age of menopause, not someone who is, 35. But by definition, if a patient comes in and they're 51 and it's been a year since their last cycle, especially if they're having symptoms, I can pretty definitively tell them that, you're in menopause, you're not ovulating anymore. And any time someone has bleeding after that, it should always, always, always be worked up because that's the most common presenting symptom of endometrial cancer.
I have to say, Dr. Jones, you're like the nicest doctor ever. I'm doing a medical prank video where I call my fellow physician colleagues and I ask them absurd medical questions, and you've been the nicest human. Literally, I'm telling you nonsense about the menopause being a pause and restarting, and you're telling me medical exclusions where it may happen? Seriously, bless your heart.
I told my husband, oh my God, I'm so happy you're joking. I was like, Mike either has no idea what he's talking about or I've said something horribly confusing in a video.
Speaking of unprofessional medical conduct, would you trust a doctor dressed like this? Or would you trust a doctor who's on TikTok? Click for one of these 2 videos, and as always, stay happy and healthy.